कुछ कर रहा है यार, देता हूँ जॉब को लिमिट हो सके।
Hello guys, can you hear us? Can you see us? If so, tell a hi, hello in the comment box. So welcome back everyone. So we had a launch of Shushruta batch yesterday for the third year of MBBS students. I am here with Dr. Sudha ma'am, the ophthalmologist. We will be giving even more a better clarity on what is to be done and what are the challenges for a student who is in the third year of MBBS and how this batch is going to help them to overcome the challenges. Thank you, Vishal. So first thing is the Sushruta batch is a live batch which will be catering for all the third year subjects. Along with that, we'll also have final year subjects over the weekend, right? So if you look generally, there are quite a few challenges faced by a student, especially when they come to third and final year. Can you guys tell me how many of you are in third and final year in the comment box? Vishal, which year are you in? Hello, Lalit. So if any one of you are in third and final year, let us know. Hello, sir. Manjunath sir. Manjunath sir is with us as well. So if you look at the third and final year batch, there are a few main challenges which we have got to know from good number of students giving us an input. First thing is that once you go to your third year, I am sure your clinical postings will start. Once your clinical posting starts, morning you go to the posting, sometimes it'll be very hectic. Evening theory class might happen, might not happen. And what happens is you're not so regular. If it's a medicine posting, a very hectic posting, you go through that. You complete that medicine posting, there'll be an end of posting exam. You kind of ignore opthal, ENT, forensic, and PSN during that time. Surgery posting will be hectic. Labor ward will start in OBG, that will be hectic again. So there's no regular and disciplined approach to theory part of the third year subjects. So okay, let me do it close to the exam. That's one of the major concerns. Second is, most of you, when you come to third year exam, what happens is you guys start preparing for your NEET PG or next exam or INACT. So it goes more towards MCQ based subject learning. So an MCQ based learning is important, I'm not denying that, but without core concepts, the MCQ will be like memorizing them. It will not help you in acing the exam to the level you want to, right? So kind of the prof exam and conceptual learning is reducing because of the crunch in the time. You have the postings, you have your university exam, and also you have to prepare for NEET PG. Third is, there are lots of resources for you to learn. But how to examine a cataract patient, or how to use an otoscope, or what exactly is PSM, how it's going to help you, and forensic medicine, right? The clinical skills enhancing is a little bit less. This is what students have told us. And how to correlate what I see in the slit lamp in a real life or an chalazion to the theory part, right? So correlation of this clinical and theoretical topics, these were the major challenges which are faced by students, which is communicated with most of us, right? Sure, Lalit, we are there to solve all these things, right? Okay, Sudha ma'am will be able to reply to you. Ma'am, you have a patient as well there. Dr. Lalit has some vision defect. She'll take care of you when you attend the classes. You'll know what happens exactly there also, right? So this were the thoughts behind launching the Sushruta batch. The Sushruta batch, named behind the father of surgery, the main motive here is to make a comprehensive learning plan for your prof exam, for your NEET PG next exam, to clear your practical exams of ENT after as well, right? So this batch, we have the grade 4 faculties with us. Along with this, like I said, it's not just for prof exam, it's also for your NEET PG and next exam. And in addition to this, you'll have a little bit of classes based on your major subjects and minor subjects in final year, like yesterday it was presented. Over to you, Sudha ma'am, like what do you think how a student should approach ophthalmology and what is lacking now and how we will be able to bridge the gap? Over to you, ma'am.
So thank you, Dr. Ranjit, and hello everyone. I am Dr. Sudha, your ophthalmology faculty. And देखो बच्चों, this session is meant to kind of orient you to the Sushruta batch जो हम लोग अभी March mid से शुरू करने वाले हैं. So as Dr. Ranjit said, it's time to start studying क्योंकि देखो first year तो निकल गया with the excitement of coming to medical college एंड सेकेंड ईयर के सब्जेक्ट्स थोड़े लाइट होते हैं, सो यू टेंड टू एंजॉय, हैव फन, यू थिंक दैट एमबीबीएस अभी बहुत लंबा चलने वाला है. नाउ यू आर लाइक हाफ वे इनटू इट, अभी तुम्हारा थर्ड ईयर शुरू हो गया है, तो अभी पढ़ाई को लेके थोड़ा सा ना सीरियस हो जाओ. तो सीरियस होना ही पड़ेगा फॉर टू रीजंस. वन इज कि अभी से ना क्लिनिकल पोस्टिंग्स शुरू होने वाली हैं इन अ प्रॉपर वे, सो क्लिनिक्स आर गोइंग टू बिकम इम्पॉर्टेंट. और दूसरा, नाउ इट इज टाइम टू चैनलाइज योरसेल्फ इन सच अ वे कि जब तुम्हारा खत्म होगा ना ये, तो तुमको नीट पीजी के लिए भी तुम्हारी जो तैयारी है वो एटलीस्ट हाफ वे तो होनी चाहिए, क्योंकि हम ऐसे इंटर्नशिप में शुरू करके नीट पीजी क्लियर नहीं कर सकते हैं. So like third year is the right time to start preparing for all this. But जैसे डॉक्टर रंजीत ने बताया, there are lots of challenges, क्योंकि अभी clinical postings होंगी, वो postings hectic होंगी, उसके बाद फिर तुम disciplined तरीके से रोज जो पढ़ाई है वो कर नहीं पाओगे, या फिर you find it as a challenge कि हम कैसे करें. So as Dr. Ranjit said, and also जो clinical skills हैं, they are very very important to how to develop the right kind of clinical skills and how to correlate the clinical things with जो theory तुम जो पढ़ रहे हो उसको हम clinics के साथ कैसे correlate करें. तो ये जो चीजें हैं, this is what we will be doing in our Sushruta batch. So I will help you, I will just run you through the details of the batch कि इसमें हम क्या क्या करने वाले हैं, and with a little bit of emphasis on my subject, that is ophthalm. So what is the idea behind this batch is, इसमें हम नीट पीजी और यूनिवर्सिटी एग्जाम दोनों का ही करिकुलम हम कवर करने वाले हैं. सो व्हाट डू वी मीन बाय दैट? इसमें वी विल बी हैविंग क्लासेस 6 days a week. 6 दिन हमारे क्लासेस होंगे शाम को 1 से 2 घंटे के लिए. सो इसमें 4 दिन वी विल बी कवरिंग द थर्ड ईयर सब्जेक्ट्स. सो थर्ड ईयर सब्जेक्ट्स में है हमारे पास ऑफ्थल्मोलॉजी, ईएनटी, वी हैव पीएसएम एंड वी हैव फॉरेंसिक मेडिसिन एंड टॉक्सिकोलॉजी. ये हमारे कोर्स का सब्जेक्ट्स हैं. और इसके साथ 2 दिन जो है वी विल बी हैविंग द फाइनल ईयर सब्जेक्ट्स. बट फाइनल ईयर सब्जेक्ट्स की थियोरी हम नहीं करेंगे, हम इसमें बेसिकली वी विल ट्राई टू कॉन्सेंट्रेट मोर ऑन द क्लिनिक्स. जबकि जो 4 days ऑफ कोर थर्ड ईयर सब्जेक्ट्स है ना, जैसे हमारे IENT, FMT और PSM जो है, इसको हमने डिवाइड किया है इनटू थियोरी एंड प्रैक्टिकल. So we will be doing theory which is important for your university exam, जिसमें हम long questions, short questions ये सब डिस्कस करेंगे. At the same time वाइवा और प्रैक्टिकल की चीजें भी हम डिस्कस करेंगे. जैसे इन ऑफ्थाल I will be discussing the important cases, like for example cataract. We will be discussing how to examine a case of corneal opacity, which can come as a long case. I will try to discuss the important viva questions. I will try to show you the important instruments that you must know, the important investigations which can be asked, drugs. ये सारी चीजें मतलब यूनिवर्सिटी एग्जाम के लिए जो थियोरी के लिए इंपॉर्टेंट है एंड जो प्रैक्टिकल के लिए इंपॉर्टेंट है, दोनों हम कवर करेंगे. बट एट द सेम टाइम वी विल ट्राई टू गाइड यू इन द राइट डायरेक्शन फॉर द नीट पीजी ऑल्सो. इट विल नॉट बी अ सिंपल ऐसे just a theory class. We will try to emphasize on things which are important for NEET PG so that you will be able to solve the right kind of MCQs also. So it will be a bit of both, and this is actually what I feel that most students wanted. So we have tried to design this batch in such a way. So we will have like 300 plus hours of live lectures. And we will also have subject wise tests, जिससे तुम टेस्ट दोगे और तुमको पता चलेगा which are your weak areas, कौन कौन सी चीजें तुमको दोबारा पढ़ने की जरूरत है. So at the end of each lecture there will be a daily practice and there will be class notes also, so that you know you have a rough assessment of whether you have understood what has been there in the class, and you can always come back in the next session and ask your doubts, और हम कोशिश करेंगे कि हम वो doubts को clear करें. And as Dr. Ranjit said, and as I also have been saying, we will have clinical case discussions. We will have clinical for the final year subjects, and we'll also have clinical that is practical for our third year subjects. So this will help you in 2 ways. Like third year के जो subjects हैं वो हम complete कर देंगे, theory के लिए भी, practical के लिए भी और NEET PG के लिए भी. And at the same time जब तक तुम final year में जाओगे, final year के जो main subjects हैं उसका जो clinical part है at least वो तुमको पता होगा. And you know that there is a saying in medicine that you have to, what the mind does not know, the eyes cannot see. So what will happen is अभी तुम ये यहाँ पे थोड़ा सा सीख के जाओगे ना, तो when you go to your postings it will be easier for you to pick up those findings also. A little bit of it has already been explained, so you know in your mind that this exists, so when you go you will be able to pick it up. So this is the purpose of this Sushruta batch. So I just want you to know your faculties. I think you already know them because yesterday we have had a launch with all the other faculties. I unfortunately could not be present in the session, but still I will tell you about our faculty. So I will be taking ophthalmology. I am Dr. Sudha. Dr. Jagdish will be taking ENT. Dr. Manjunath will be taking forensic medicine and toxicology, and Dr. Murugan will be doing preventive and social medicine or community medicine as we commonly call it. So these are your faculty. We will be doing the third year subjects, and the final year faculty will be doing the clinical part of the final year subjects.
And there are a few queries like Dr. Lalit has a question that आप बताया क्या 0.5 DCYL? I don't know what is that. Do you need specs for that power?
For 0.5 cylinder, yeah, it depends if you are actually having asthenopic symptoms, and then you should be wearing your glasses. Ideally, anybody who has any kind of refractive error should be using glasses. And if you don't use the glasses, then you will have problems. You will start having headaches. You will not be able to concentrate on your studies. So if you think that your glasses are not suiting you, go to any ophthalmic clinic, get your refraction reevaluated. चश्मे का नंबर दोबारा एक बार चेक करवा लो अगर तुम्हें लगता है चश्मा सही नहीं है, लेकिन चश्मे का नंबर अगर है तो उसको पहनना तो पड़ेगा.
Lalit, hope your query is sorted. And Dr. Tajveer says that you're the best and he's a big fan of yours. And Lalit has also said that Ophthal is his favorite subject. I'll be very honest, ma'am. Ophthal is one of the subjects which I didn't like when I was in MBBS. Sorry for all the ophthalmologists out there. But one thing, what I felt was like ophthalmology, when I wanted to go and see a patient or be it in the theater, it's not visible only.
Correct.
Like,
that's one of the major problems that we have in ophthalmology and also I think this same is true for ENT.
Yeah.
When I was an undergraduate student, we used to do only torchlight examination and we actually didn't get to see much. And we used to have teaching OTs where we used to have screens, but still everything was microscopic, so we didn't understand most of it. So I agree that it's very difficult for a student to develop interest in ophthalmology as an MBBS student. So that is a problem we'll try to solve for these subjects like ENT and Ophthal. We'll try to show you, like I'll try to show you slit lamp images, and we will try to correlate these things clinically, give you a clinical picture so that you understand, get a much better understanding. And similarly, I'm sure that Dr. Jagdish will have a lot to show you. He is a very good clinician, and so he will have a lot of things to share with you. And our other two faculty, like Dr. Murugan, will tell you about PSM, and public health is like the cornerstone of medicine, which we all understood in the COVID pandemic. So it's a very, very important subject, and it is the basis of community health. So that's very important. And as doctors practicing today, we understand how medical legal issues are plaguing us all. So Dr. Manjunath will give you an idea about that. So we will try to introduce you to clinical practice also, because this is your first step ना. अभी से तुम जो clinic से उसमें जाने वाले हो, तो patient के साथ how to behave with the patient, these things you will be learning in the clinic. So we will also try to pitch in over there. We'll try to help you as much as we can in how to examine the patient, what are the findings, how to go approach a patient. These things we'll try to do in our practical sessions.
Great. I hope the batch will help most of students, because as a MBBS student, my major concern with ENT and Ophthal was it's not visible. Like the ENT, my surgeon will say that there is a retraction of the tympanic membrane, but I cannot see anything of that. I think Dr. Jagdish has a pocket microscope, pocket ENT otoscope now. With its camera, he can display all the cases. And like you said, you will be putting up the slit lamp images and the surgical images, which will make students have a better understanding, I hope.
Yeah.
Dr. Lalit still has a question. If there's no astronomic symptoms, what to do?
Dr. Lalit, it's very, very difficult to answer these questions online. I think it's better you have a consultation, because I say, no, don't wear your glasses, and 2 days later, you'll end up with a headache. So see, the basic dictum is if you have a refractive error, you have to wear the glasses. But if the power is like really small, as you're saying, it's like 0.5, it's better to get yourself re-evaluated and to see if actually that is the power or it's even less than that. and see how it is suiting you. So if you think that the glasses are not really are causing you more trouble than they are helping you, that's why I think you're probably asking the question. Get yourself re-evaluated at with some ophthalmologist close to you.
That's great. Let's hope your query is sorted. Yes, and Aman has a query that will you be teaching from basics of ophthalmology?
Absolutely. We will be starting right from the anatomy, physiology, because ophthalmology it's a new subject, right? So we will be going right from the beginning and we will try to reach a level, like I said, we will be starting with the codes and the contents of the eyeball, where we will be learning these are the names of the structures of the eye. And by the end of the course, I want to take you to a level where if somebody asks you that if there is a tumor in the brain which is pressing on the optic chiasma, what is the visual field defect that you're likely to see? So that is the journey we have planned. And if you study with us, I think that by the end of the course in all the subjects, this is just an example I gave you from opthal, इस लेवल पे हम रीच करना चाहते हैं, starting from the basics. So if you study with us, I think you should be able to reach that level in all the subjects.
That's great. So this is the short of what opthal will be there in the Shushruta batch, and we had Dr. Jagdish, Dr. Manjunath, and Dr. Murugan sir attending the launch event yesterday. And yesterday there were a few queries from the students. The plans were not clearly visible, and here are the plans. The Vishwas offer is still there. So if you're a newly joined first year student, you have an extra 12 month plus 1 month duration of the validity. And the discounts are starting at 57 percentage, going up to 80% in a sub batch, right? The third year Shushruta batch, for students who are going into intern, taking an intern or post intern batch, you will have the access to that. The batch is launching at 18th, so till that time you might not have an access. If not, please connect with any of the teachers or the PW in the Telegram group or in the Instagram. We'll get it sorted. The third prof batch will be at 5,999, which includes the recorded lectures, the live lectures of Shushruta batch, for not just for third year, also the fourth prof lectures, the case history taking of medicine, surgery, OG, pediatrics, orthopedics, psychiatry, and others. And you'll have DPPs, you'll have subject-wise tests, you'll have the PYQs, and you'll have the soft copy notes of both the live lectures as well as the recorded lectures. All this will be included in that. Samir, there's a question that if you're in third year, I'll leave it to you. If you want to take an intern batch or a third year batch, that's completely at your disposal. But I would say third year will have good amount of medicine, surgery, OBG, pediatrics also covered. So I would say the intern plan will take care of it because it will have a wider thing. If you want to just revisit some old concepts of anatomy, you can go to that. Pathology, you can go to that. And intern students also will have the access to the Shushruta batch. So that also will be taken care of it. Fine. Okay, Lalit, like ma'am said, it will be better if an ophthalmologist examines you, right? So that will be giving a better understanding about the requirement of glasses than prescribing without that. That's what it is, right? Okay. Vaibhav has a question of first aid. Like I wanted to take about this first aid because there are quite a few people who are recommending first aid to learn. This is my take on first aid. See, first aid is an amazing book. I have no second thoughts about that. The only concern with first aid is it's all point wise. So if you made sure your first year, second year, third year, final year is good in your MBBS, first aid is an amazing source. If you think that your prof is not that great, first aid is nothing but memorizing. So that time it will become a bit hectic. So if your MBBS is good, first aid is a very good source to revise all of them up to the point for an exam point of view. That's what first aid is basically meant for. But if your MBBS is not good, first aid might sometimes be difficult. Keep that in mind and go ahead and read with that. Fine. Okay. Harsha, the Telegram group of PW, just search PW Method, you will be getting access to that. So this offer will be there till the March 10th. So if you guys are interested in either the third year batch or like Samir asked, if you can go for the intern batch as well, you will get the Shushruta batch as a part of intern, post-intern batch of NEET PG or FMG. Fine. ललित मेरा हिंदी थोड़ा खराब है ललित, इसलिए मैं अंग्रेजी में बोल सकता हूँ. So that's why I'm not so good in Hindi. if I start speaking in Hindi, whatever is there in the head is not coming outside. A thought block happens. That's why I'm a bit more comfortable in English. So I'm talking in English, right? So if you have any other doubts, do contact any of the teachers or the PW, the student counselors. We'll be more than happy to help. Any words, ma'am, from you for the students who are actually, this is the time where their second year is over. They are getting the results slowly, one by one. Your in the universities, and they are going to enter third year. So, what is your advice for young students who are entering third year? What they should do?
Yeah, so this is what I said at the beginning also, कि 2 साल तो मस्ती कर लिया. It's understandable. College life is meant to enjoy. But now that you're in third year, now you have to start taking your studies a little more seriously. So discipline तरीके से रोज अपने लिए 2 घंटे निकालो पढ़ने के लिए. मैं ये नहीं बोल रही हूँ कि तुम सारा दिन पढ़ो. No, that's not possible, and actually that's not necessary also. बट कम से कम 2 घंटे अपने लिए यू हैव टू टेक आउट फॉर योर ओन स्टडी. मतलब वो कॉलेज वाला टाइम नहीं है, नॉट द टाइम दैट यू गो टू कॉलेज. एवरी डे फॉर योर ओन सेल्फ स्टडीइंग यू हैव टू टेक आउट अ कपल ऑफ आवर्स. सो वो अगर हम डिसिप्लिन तरीके से पढ़ेंगे ना राइट फ्रॉम थर्ड ईयर, यू विल फाइंड दैट बाय द टाइम यू आर एट द एंड ऑफ योर कोर्स you are like reasonably prepared for NEET PG. तुम्हारा जो basic का काम है, your concepts are clear, you are clinically correlated, you're integrated, like you're able to integrate path, pharma with medicine, you're able to integrate anatomy with surgery. ये जो चीजें हैं ना, ये तभी आएगा जब हम इसको लॉजिकली पढ़ेंगे. एंड आई थिंक थर्ड ईयर इज द राइट टाइम टू स्टार्ट इट. First year, second year, I really don't expect children to be so oriented. They will not be. But now that you have completed 2 years, तुमको समझ आ गया है ना कि medical college is not something which cannot be cleared easily if you want to do it the right way. And another thing is कि अभी थर्ड ईयर में हो तो ठीक से पढ़ो. Don't try to memorize things like just from textbooks which are meant for last minute revision. वो last minute revision के लिए ठीक है, जब हम बिल्कुल एग्जाम के पीछे we just want to look at the high yield stuff. बट अगर हमें कोर कॉन्सेप्ट्स को समझना है तो हमें थोड़ा सा डिटेल में तो पढ़ना पड़ेगा ना. वी हैव टू गो इनटू द डेप्थ ऑफ थिंग्स एंड दिस इज द राइट टाइम टू डू इट. सो स्टार्ट, बी विथ अस. वी विल ट्राई टू स्ट्रेंथन योर कॉन्सेप्ट्स. I always encourage students to read standard textbooks in MBBS because what you do in MBBS lays the foundation for the rest of your life. So later on, see, today I am doing opthal. उस तरह से देखा जाए तो मेडिसिन के साथ मेरा कुछ स्ट्रॉन्ग कनेक्शन नहीं है. आई कैन ऑलवेज सेंड अ पेशेंट ऑफ मेडिसिन टू अनदर कलीग एंड दैट इज व्हाट आई विल डू. बट इफ देयर इज एन इमरजेंसी, आई शुड नॉट come out. I am a doctor. I should be having some basic knowledge about it. So you should be able, if somebody asks you something about hypertension, you should be able to tell him something basic. You don't give him everything, but at least basic you should be able to answer. So that is going to happen only if you read properly. So the basic advice is read in detail. So, and you can always revise, do rapid revision and learning from point-wise books at the end, close to your exams. Okay, so stay with us. We'll try to strengthen your concepts and see. It's like last year at Vishwas Divas, on Vishwas Divas, our PW MedEd was officially launched and we've had a great year. And that is why this whole thing was introduced. And so that I would request all of you that do join the batch, do study properly and make yourselves, make us and make your parents, everybody proud by becoming good doctors, good clinicians.
Okay, thank you, ma'am. There are a few queries more, ma'am. What's the standard book for ophthalmology?
I'll be telling you all this in the class, but see, what are the standard books for ophthalmology? We have all grown up learning Parsons, reading Parsons, and we also have comprehensive ophthalmology by Dr. Khurana, which students in India read. So you can choose any one which suits you.
Great.
So, but you do read a textbook.
Great. So see you guys in the Shushruta batch and hope we'll learn more together. For final year students, we have something ready for you as well. So we'll be launching that soon. Don't worry. We'll make sure the goal is only one thing, to teach with responsibility. That's going to be our tagline forever. The goal is to make you good doctors, and obviously on the way, NEET PG or next or INST or FMG will be taken care of it. Fine. So thank you guys. Lalit, treatment for esotropia, especially with convergence, ma'am, your take. Dr. Lalit has a question.
We will discuss all this in the class because these are concepts. I cannot just tell you offhand and it's not going to help you. So we'll do come to the class, Lalit. We'll discuss all this in the class. When we discuss convergence and when we discuss squint, you will be able to tell me the answer yourself.
Great. Thank you, ma'am. Thank you, everyone, for your patient listening. See you
Thank you very much, everyone. See you in class.